Good morning, doctors and friends. Today we will talk about Mediterranean diet. People have learned to enjoy food because it is essential for their life. The principle of sustainability has been applied to variables affecting food security over the last decade. As a result, a more systematic and holistic approach to sustained food systems has emerged, taking into account considerations such as environment, demographic, social culture, economic factors, technology, and globalization. Increasing demand for animal products could pose a significant threat to food security and biodiversity, given that natural resources are already under stress and degradation. So, the Mediterranean diet, or MED diet, is an indicator of a healthy lifestyle decision that has been clinically shown to protect human health from preventing serious chronic and inflammatory diseases. The Mediterranean diet is a diet originating from the ancient communities around the Mediterranean basin. Is based on a regular consumption of olive oil, such as added fat, plant foods like cereals, fruit, vegetable, tree nuts, and seeds, moderate consumption of fish, seafood, and dairy, and low to moderate alcohol use, such as red wine, and limited consumption of red meat. Thank you.
I'm Vicky Samantha with the last three digits of student number 079. So these are the problems of our topic, and the purposes are to explain the definition and the description of Mediterranean diet, the epidemiology regarding Mediterranean diet, the purposes and benefits of Mediterranean diet, the hazardous considerations and side effects of Mediterranean diet, the special precautions of Mediterranean diet, the suggestions for Mediterranean diet, and the sample menu of Mediterranean diet. This paper is useful in increasing knowledge and understanding for medical students regarding Mediterranean diet, including its definition, description, epidemiology, purposes and benefits, hazardous considerations and side effects, special precautions, suggestions, and sample menu of Mediterranean diet. This knowledge is the basis for medical students so that later they can fully understand various cases associated with Mediterranean diet.
Hello, my name is Widya Harawati with last year's student number 105. According to Kamus Besar Bahasa Indonesia, diet is a special dietary rule for health and so on which is usually based on doctor instruction that help us to regulate the amount of food and drink that enters the body to achieve an ideal body weight. In carrying out a diet, a program that is appropriate for the age and body needs is needed. Current diet programs have various kinds and the end result between each other is different. One of the diet programs that can be done is Mediterranean diet. The Mediterranean diet is a traditional diet of European society which focuses on combined ingredients from local agriculture. The Mediterranean diet is characterized by plant-based food such as bread, pasta, rice, vegetable, legumes, fruit, and nuts, the use of olive oil as the main source of additional fat, moderate consumption of fish, seafood, poultry, dairy product, and egg, as well as small amount of red meat and daily moderate intake of wine generally at meals. Nowadays, Mediterranean diet is considered one of the most worldwide healthy dietary pattern, which rich mainly in antioxidant and anti-inflammatory nutrients.
My name is Rosabelujan Priatna with student number 115. So for the epidemiology, the Mediterranean diet is a traditional dietary pattern eaten by people living in the olive tree growing areas of the Mediterranean regions before the mid of 1960. This region including Greece, Italy, Turkey, Spain, southern France, parts of the Middle East, and also northern Africa. Mediterranean diet is characterized by high consumption of vegetables, fruits, nuts, legumes, and unprocessed cereal, with low consumption of meat and meat products, and also low consumption of dairy products, with long preservable cheeses as exception. Next, Ansel Keys, an American scientist who was the first to notice the relationship between the low incidence of cardiovascular disease in some traditional Mediterranean communities and their specific dietary habits initiated in the late 1950s. The study was based on the observations that residents in regions around the Mediterranean Sea had the lowest rates of coronary heart disease. And the study shows that low content of saturated lipid in the Mediterranean diet, explaining the low incidence of the coronary heart disease in the Mediterranean countries through the reductions of blood cholesterol. Thank you.
Swastiastu. My name is Chakrasindan Muswati with 3 digit of student number 231, and I'm going to explain about the purposes and benefits in Mediterranean diet. So the purpose of the Mediterranean diet includes reducing blood cholesterol by consuming foods that are low in cholesterol, low in saturated fats, but high in polyunsaturated fats. So various benefits of this diet, in particular issues such as the first one is cardiovascular disease and cardiovascular risk factors such as hypertension, metabolic syndrome, diabetes, and obesity. So this diet also has a cardioprotective effect with the content of alpha-linolenic acid, which make it more effective in primary and secondary prevention of coronary artery disease. Next one is Mediterranean diet has also been related to the development of neurodegenerative disease, such as Alzheimer's disease, that may improve cholesterol, blood sugar levels, blood vessel health, which has a high chance of reducing the risk of Alzheimer's disease or dementia. And the last one, this diet have been favorably related to several specific neoplasm and oral cancer, and some research say that the vegetable and fruit consumption has a high probability in reducing the risk and cancer of oral cavities, pharynx, esophagus, and stomach.
Good afternoon, my name is Belati Salung Saraswati, number 152. Besides having many benefits, every diet also has things that must be considered. Same thing with Mediterranean diet. In this diet, we will consume large amount of fat, so it has potential to cause weight gain. Besides that, Mediterranean diet has the potential to decrease iron levels due to less meat consumption. The consumption of dairy products is also reduced, so there will be a loss of calcium. When following Mediterranean diet, make sure to eat foods rich in vitamin C to help the body absorb iron. In this diet, wine is a common drink. Therefore, avoid wine if you are pregnant, have a risk of cancer, are prone to alcohol abuse, or any other situation that could be made worse by drinking alcohol.
Good afternoon. My name is Claudia Felicia Limanda, and I will continue to explain about the special precaution for the Mediterranean diet. So there are some things that need to be considered. The first one is the phenolic substance. So the phenolic substance tend to be forgotten by the people who try this diet. Only the monounsaturated fatty acids are considered by them. So if there is a great variation in the phenolic compound, it may reduce the grade of the olive oil and in the end will reduce the effectiveness of this diet as well. And the second one is the vitamin D consumption. For the people who use this diet, there is usually a decrease in the consumption of the vitamin D. So there need to be another sun exposure and some supplements that need to be eaten or consumed in order not to have a deficiency. That's it from me. The next part will be explained by my friend.
Hello, my name is Bagus Nanakastia with last digit student number 032. Mediterranean diet is not just a way of eating special food, but it's kind of a philosophy regarding all dimensions of an individual. It changes the individual lifestyle habit toward food and the use itself of the food. Based on fact, adhering to MD means learning food preparation skills, variety of food practice, and culinary behavior, combining smell of food and nice dish with unique Mediterranean culture and tradition that transfer from generation to generation. In this pandemic of COVID-19, MD also has been suggest for health promotion. It has been declared that balanced diet might build up the immune response to SARS-CoV-2 infection. Moreover, the approval of a healthy lifestyle, including physical exercise and diet, can decrease the risk factor associated with the thrombotic complication of COVID-19. Obesity is linked up with hypercoagulopathy discovered in severe COVID-19, and pregnant women with a COVID-19 present increase the dimer and fibrinogen levels. In fact, children from mothers that adopt a Mediterranean diet during pregnancy are protected from cardiometabolic risks such as blood pressure and blood level of lipid, CRP, and adipokines. Mediterranean diet lifestyle should be organized into strategies for treatment and prevention of overweight and obesity, especially in women of childbearing age. Thank you.
My name is Christian Bastiantalo, number 075. Okay, for next we have the body mass rate. Right here we have 1,334.85 kilocalories, but we rounded up for 1,300 kilocalories. Next, we have the activity, and we have right here 2,189.154 kilocalories, and for the SDA is 10% from BMR. So right here we have 333.485 kilocalories, and for the energy intake we have 2,300 kilocalories. And for the TAF of thermic of food, we have 230 kilocalories, and for the activity is 40% from the energy times energy. So we have right here is 920 kilocalories, and for the total energy output we have is come from BMR plus TAF plus activity. So we have right here is 2,450 kilocalories. And for the carbohydrate itself, we have right here is 337 gram, and then for the protein is 91 gram, and for the fat is 82 gram.
Hello, my name is Putri Agnes Monica with Trila student number 100. So let's talk about the menu for the Mediterranean diet based on the total energy output and also presentation of the carbohydrate, protein and fats. For the daily menu, we have 3 times for the main menu and 1 times for the snacks. Let's start with the breakfast. So for the breakfast, we have appetizer, and the appetizer we have salad with boiled carrots, boiled string beans, and also raw cabbage mixed with 2 teaspoons of olive oil. For the main menu, we have a sandwich that contain of 2 slices of toasted wheat bread with 1 teaspoon of olive oil, and boiled crab's meat and boiled chicken eggs with 1 teaspoon of olive oil. And for the dessert, we have roasted almond, and for the beverage, we have a glass of guava juice without sugar. Thank you.
Hello, Dr. Hello, my friend. My name is Narsara, student number 135. This is the menu for the lunch. This is the table of contents. From this, we also make the appetizer salad from boiled corn, boiled snow peas, and 2 tablespoons of olive oil. For the main course, there's hazelnut slow cooker and tuna with 2 teaspoons of olive oil, salted spinach with 1 tablespoon of olive oil, and the last is dessert from melon and apple. Thank you.
Hello, my name is Jyoti Matel Kurnia with name 006. So now I'm going to explain about the snacks and the dinner for Mediterranean diet. So the sample snacks that we can give for Mediterranean diet, the first one is a half portion of pineapple, which contains 24 grams of carbohydrate. The second one is watermelon, with the portion is 1 big slice, which contains 12 grams of carbohydrate. And the third one is two medium piece of sweet orange, which contain 12 grams of carbohydrate. The fourth one is papaya, 1 big slice, which contains 12 grams of carbohydrate. And the last one is non-fat yogurt. The portion is 1 cup, which is 200 milliliters, which contain 15 grams of carbohydrate and 10.5 grams of protein. So the total carbohydrate, protein, and fat for the snacks is 75 grams of carbohydrate, 10.5 grams of protein, and 0 fat. Next, so the next one is the dinners. So for dinner, we can give 1 cup of red rice or brown rice, which contain 46 grams of carbohydrate, 4.5 grams of protein, and 1.8 grams of fat. The second one we can give is shrimp, 10 medium portion of shrimp, which contain 0 carbohydrate, 14 grams of protein, and 4 grams of fat. The third one we can give is olive oil. The portion is 2 tablespoons, which contain 0 carbohydrate, 0 protein, and 20 grams of fat. The fourth one is broccoli. The portion is 100 grams, which contain 5 grams of carbohydrate and 1 grams of protein, which is 0 fat. And the next one is mango with a half medium portion, which contain 24 grams of carbohydrate and 0 fat and 0 protein. And the last one we can give is non-fat yogurt. The portion is 1 cup, which is 200 milliliters, which contain 15 grams of carbohydrate and 10.5 grams of protein without any fats. So the total carbohydrate, protein, and fat that we give in the dinner is 90 grams of carbohydrate, 30 grams of protein, and 20.8 grams of fat. Next. So this is the reference that we used for this student project. Next. So that is it for our presentation. Thank you for your attention, and God bless you.